First at 9, a doctor from Walker County had the chance to testify before a U.S. Senate committee last week in Washington.
He's fighting for more diversity in the healthcare field. Our Lauren Harkson talked with the doctor today to get some insight on that hearing. Lauren, what did they talk about?
Well, Brittany, Steve, this is Dr. Brian Stone, president and chief of the medical staff of Walker Baptist Regional Medical Center. He grew up here in Alabama, but spent 26 years in New York City, saying the exposure to so many different people and cultures really helped him appreciate the need for diversity in healthcare. The hearing he testified at last Thursday, titled "What Can Congress Do to Address the Severe Shortage of Minority Healthcare Professionals?" focused on just that. Dr. Stone says Alabama has around 5 million people and 25% of the population is black, but only 6 to 7% of our physicians are black. He says the reason diversity in the physician workforce is so important is because the cultural connectivity has a lot to do with patient compliance and patient outcomes.
And seeing the trust and the bond and being able to explain medications and all these things help with outcomes. We need representation from all the groups if we're going to help people get better. And we have an unhealthy population, you have an unhealthy workforce, people aren't as productive. So that's why this is so important.
Dr. Stone says this goes for every culture and every population, adding we tend to trust those who look like us. So having a doctor that does can help with our overall health. To accomplish this, he's advocating for enhanced STEM education in schools, but says we also need to reduce the financial burden of medical education and increase the sizes of medical school classes. Steve?
Thanks, Lauren. Speaking of